Blood clots are silent threats that can lead to serious health complications if ignored. Recognizing early signs can save lives and prevent potentially life-threatening conditions. Watch out for these alarming symptoms and take action to protect your health immediately. Sudden swelling in limbs. Unexplained swelling in your arm or leg could be a sign of a dangerous blood clot. This swelling often comes with redness, warmth, and tenderness in the affected area. Seek medical help immediately if you notice one limb is suddenly more swollen than the other. Quick action can prevent the clot from moving to vital organs like your lungs or brain. Persistent pain in the calf. Pain in your calf without an obvious cause might be linked to a deep vein thrombosis or DVT. This pain often feels like cramping or soreness that doesn't improve with stretching or rest. Don't dismiss calf pain as a minor issue, especially if it's one-sided and persistent. Consult a healthcare professional to rule out serious issues like blood clots, chest pain, or difficulty breathing. Sudden sharp chest pain or trouble breathing can signal a pulmonary embolism caused by a blood clot. This condition requires urgent medical attention, and delaying treatment can have fatal consequences. Breathing difficulties accompanied by dizziness or a rapid heart rate are serious red flags. Call emergency services immediately if you experience these life-threatening symptoms. Red or darkened skin in the affected area. The skin around a blood clot may appear red or take on a bluish tint, indicating poor circulation. This discoloration may worsen over time as the clot blocks normal blood flow. Don't ignore unusual skin changes, as they might point to underlying blood clot issues. Early detection and medical evaluation can prevent complications and improve recovery outcomes. Stay tuned for the next part to learn more crucial symptoms and life-saving tips. Unexplained fatigue or weakness. Feeling unusually tired or weak without a clear reason could be a hidden sign of a blood clot. This fatigue often comes on suddenly and may not improve with rest or sleep. Blood clots can disrupt oxygen flow, causing your body to work harder and feel drained. Persistent fatigue is your body's way of signaling something isn't right. Pay close attention. Sudden and severe headaches. Intense headaches, especially when accompanied by vision changes or confusion, may signal a blood clot in the brain. These headaches often come on quickly and feel worse than typical migraines. Don't dismiss sudden headaches if they feel unusual or are paired with other symptoms. Seek immediate medical help to rule out dangerous conditions like a stroke or cerebral thrombosis. Warmth or tenderness in the affected area. Blood clots often cause localized warmth or tenderness that feels unusual compared to surrounding areas. You might notice this symptom in addition to swelling or discoloration in the same spot. Tenderness that worsens over time is a strong indicator of a possible clot developing underneath. Don't ignore these subtle signs, even if they seem minor. They might indicate a serious issue. Unexplained rapid heart rate. A blood clot can make your heart work harder, leading to a fast or irregular heart rate. This symptom is often accompanied by lightheadedness or shortness of breath, which shouldn't be ignored. If your heart rate suddenly feels faster than normal, seek medical evaluation immediately. Timely treatment can prevent the clot from causing more severe complications. Pain that worsens with movement. Blood clots often cause pain that intensifies with movement and eases when you're resting. This type of pain is most common in the legs and might feel like pulling or cramping. Don't ignore movement pain, especially if it feels different from muscle strain or injury. Early medical attention can save you from further complications, such as clot migration. Blue or purple fingertips. Discoloration in your fingers could mean a clot is obstructing blood flow to smaller vessels. This symptom may come with numbness, tingling, or a feeling of cold in the affected area. Don't dismiss sudden changes in your fingertips, as they may point to circulation problems. Reach out to a doctor immediately for evaluation and further tests to determine the cause. Difficulty breathing or shortness of breath. If you suddenly experience shortness of breath or difficulty breathing, this could be due to a blood clot in the lungs. Blood clots in the lungs, known as pulmonary embolism, can cause sharp chest pain and tightness. This symptom may be mistaken for a panic attack or asthma, but it requires immediate medical attention. Don't ignore these warning signs, as pulmonary embolism can be life-threatening if untreated. Swallowing in one leg. Swelling in just one leg or arm is a common sign of a blood clot in the veins, or deep vein thrombosis, DVT. The affected area may feel heavy, painful, and warm to the touch as well. This is often noticed more when standing or walking and may worsen over time. If the swelling doesn't go away or gets worse, it's important to see a doctor immediately. Coughing up blood. Coughing up blood can be a sign that a clot has moved to the lungs, causing a pulmonary embolism. This is a serious symptom and requires urgent attention if it happens. Even a small amount of blood in your sputum should be taken seriously and reported to a healthcare provider. Ignoring this could result in severe complications and even death if not treated promptly. Sudden vision changes. Blood clots in the brain or eyes can lead to sudden vision changes, including blurred or double vision. You may also experience flashes of light or even complete vision loss in one eye. Sudden vision changes can indicate a serious clot or stroke and should not be ignored. If you notice these changes, seek medical attention immediately for a full evaluation. Pain in the chest or back. Chest or back pain, especially when it's sudden and severe, could be a sign of a blood clot in the lungs or heart. This pain may be sharp stabbing or a tightness that doesn't go away. If the pain comes with shortness of breath or dizziness, it's crucial to seek medical help right away. Immediate evaluation can help prevent a life-threatening event like a heart attack or pulmonary embolism. Skin discoloration or redness. Skin discoloration or redness is a common symptom when blood flow is blocked due to a clot. The affected area may become warm to the touch and appear red or purple in color. This is often seen in cases of deep vein thrombosis, but can also occur with clots in other parts of the body. If you notice unusual skin changes along with other symptoms, seek medical care immediately. Difficulty speaking or confusion. Blood clots in the brain can cause sudden confusion or difficulty speaking clearly. This might feel like you can't find the right words or your speech becomes slurred. If you experience these symptoms with other signs like numbness or weakness, it's critical to act quickly. Seek immediate medical help, as time-sensitive treatment can prevent long-term damage or disability. Unexplained fatigue or weakness. Feeling suddenly fatigued or weak for no apparent reason can be a sign of a blood clot. This could indicate that a clot is restricting blood flow and affecting your body's energy levels. If you feel constantly tired despite adequate rest or experience unexplained weakness, it's a symptom to take seriously. A clot in the leg, lungs, or heart can impair circulation and cause prolonged exhaustion, dizziness, or lightheadedness. Dizziness or feeling lightheaded could be a sign that your blood clot is restricting oxygen flow. This can be especially concerning if it's accompanied by shortness of breath or a rapid heartbeat. Sudden dizziness may also be a sign that a clot has moved to the brain or lungs. If this occurs regularly or worsens over time, it's essential to see a doctor for evaluation. Cold, clammy skin. Cold, clammy skin can indicate a lack of proper blood flow, especially when accompanied by other clot symptoms. When the blood isn't circulating properly due to a clot, the body may feel cool or sweaty, even in normal conditions. The skin may appear pale or discolored and feel damp or cold to the touch. Seek help if you experience persistent cold or clammy skin combined with other symptoms like chest pain or swelling, irregular heartbeat or palpitations. An irregular heartbeat or palpitations can be a result of blood clots affecting your heart or lungs. When a clot blocks blood flow to the heart, it can cause the heart to beat irregularly or rapidly. You may feel your heart racing, pounding, or skipping beats, which can be alarming and uncomfortable. If you notice these symptoms, it's important to get checked to rule out serious conditions like heart attack or clot-induced arrhythmia. Chest pain that worsens with movement. Chest pain that worsens with movement or deep breathing could be a sign that a clot is obstructing blood flow. You may experience sharp pain in your chest that gets worse when you take a deep breath or cough. This symptom could indicate that a blood clot has affected the lungs, causing pulmonary embolism or deep vein thrombosis. If you feel persistent or worsening chest pain, seek emergency medical care right away. Sudden numbness or weakness in the face, arm, or leg. Sudden numbness or weakness on one side of the body could be a sign that a clot is interfering with brain function. This can result in difficulty moving your arm, leg, or even speaking or smiling normally. This symptom is particularly common in cases of stroke caused by a clot blocking blood flow to the brain. If you notice these signs, it's critical to seek immediate medical attention as they could indicate a stroke or clot. Persistent or worsening symptoms. If any of the symptoms mentioned persist or worsen over time, it's a clear sign that something is wrong. Ignoring persistent signs like chest pain, shortness of breath, or swelling could lead to serious complications. Blood clots left untreated can lead to severe outcomes like organ damage, stroke, or even death. The earlier you seek treatment, the better your chances are for a full recovery and avoiding long-term effects.